Hi, my name is Margarita Cañarte. My topic is about clinical assessment of peripheral arterial disease of the lower limbs. Definitions. Peripheral arterial disease occurs when there is narrowing of the blood vessels outside the heart. The cause of this disease is arteriosclerosis. This happens when plaque builds up on the wall of the arteries that supply blood to the arms and legs.
Nifty new study guides, not here on YouTube. Click the link right up here at any time during this video. All right, guys, let's begin. Now, as far as the signs and symptoms, PVD is the veins, so use the acronym VEINY, like a veiny arm. V for voluptuous pulses, meaning the blood is being pumped. Guys, the arteries are fine, the veins are the problem here, and that's why the legs are warm. So that's a huge test tip right here. Yes, we have pulses. This means oxygen is getting to the extremity. E stands for edema, where blood starts pooling. So guys, think of an oxygen pool party in PVD. I is for irregularly shaped sores. So think of this pool party as an exotic pool that has a weird shape, which is very different than the boring PAD that's just round and smooth. Now N is for no sharp pain. Instead, we have dull pain. So no sharp pain during exercise because guys, we don't have an oxygen problem. We have oxygen because we have pulses. Unlike PAD, where we have a very sharp pain from the lack of oxygen. And lastly, Y is for yellow and brown ankles. Big test tip right there is the ankles. Now PAD is even worse, and everyone knows that. So PAD, think BAD because it's bad. Bad because we have low oxygen in the arteries. So use the acronym ARTS for artery. A is for absence of pulse and absence of hair, so we have shiny, cold legs. And imagine that, never having to shave those legs ever again. R is for round, red, smooth sores. Unlike those exotic pools in PVD with those weird shapes, in PAD we have red sores, also called rubor. So remember R for red. T is for toes and feet that are pale from the low oxygen. Or even in advanced stages, we get black toes called eschar. Big NCLEX tip right there. These black crispy feet are dead tissue. The toes have suffocated to death and usually have to be amputated, aka cut off. Now S is for sharp pain in the calves when stressed, like during exercise or even elevation, like when sitting in a lazy boy chair recliner at night. This pain is the warning signs of low oxygen. And big test tip right here, guys, write this down. It's called intermittent claudication. This key word right here, intermittent claudication, comes up a lot on exams and the NCLEX, specifically for PAD. So guys, remember, intermittent claudication is intermittent cavication because it causes pain in the calf. And the emphasis is on the A for intermittent claudication because we remember PAD, so claudication for calvication. Now, why does this happen? Well, again, guys, exercise like walking up the stairs or even across a parking lot, the muscles are using more oxygen than while at rest. So the lack of oxygen causes this calf muscle pain. And when the legs are elevated, well, it's harder and harder to pump blood uphill, right? So again, low oxygen equals mo pain. And now that you know the main testable differences between PVD and PAD, so what about the 6 Ps? You guys remember those 6 Ps the instructor always talks about? Well, guys, the 6 Ps just assess the oxygenation of the limb. Usually always the lower limb, since it's harder for oxygen to get from the heart all the way down to the legs, right? Especially with the narrowing of the blood vessels from atherosclerosis, that plaque buildup like seen here. The lower the oxygen in the extremity, the worse the 6 Ps get. It's like your limb is being strangled to death, because this is exactly what happens when the body has no oxygen. It dies, also called necrosis. So write this down. The 2 most important Ps that will be on your test and usually always comes up in prioritization questions. Number 1 is pain, but guys, not any kind of pain. Unrelieved pain at rest. Big key word right there. When claudication is unrelieved at rest, this means PAD has moved into the most severe stages. And number 2 is paresthesia. Fancy words for tingling and numbness. It's like when your leg falls asleep, but guys, this is way more severe version. It's like the leg is holding its breath for a long time or just being choked out. All right, guys, a little side note for your future exams. These 2 Ps are always the priority. Thanks for watching. For our full video and new quiz bank, click right up here to access your free trial. And please consider
Applications in medicine. The best non-invasive method for identifying the presence of occlusive arterial diseases is the encobrachial index, which can also be used to indicate the prognosis of the affected extremity and to predict the likelihood of acute myocardial infarctions during follow-up. Intermittent claudications in the lower limbs is the most common clinical presentations. The presence of critical ischemia indicates the need for prompt revascularizations because of the high risk of limb amputations.
I'm just going to run through the examination of your peripheral vascular system, if that's okay. If I start by looking for any signs of tar staining, checking capillary refill, looking for any signs of cyanosis or anemia, and feeling for the radial pulse, ulnar pulse, brachial. Just lift your arm up for me, feeling for the axillary pulse, and then the subclavian. And then we'll repeat the same on the other arm. So again, checking the capillary refill, radial pulse, ulnar, brachial, again the axillary pulse, and if you just lower your arm.
Pros and cons. Pros. Antiplatelet therapy reduces cardiovascular morbidity and mortality in diabetic patients with peripheral arterial disease. Cons. Poor management in patients with peripheral arterial disease or can lead to complications such as critical limb ischemia. Applies in Ecuador. In Ecuador, these types of pathology are diagnosed by cardiovascular specialists and together with the physical therapies are solved. And conclusions, the role played by the vascular surgeon in the evaluation of patients with cardiovascular risk factors and with clinical suspicions of peripheral arterial disease is very important, which is why the use of the tool at their disposal, the performance of diagnostic procedures and the choice management will determine the prognosis of these patients, especially if the detection is early. Thank you.